Welcome to the Our Nation News Brief. I'm Keith Pitts. Today we're going to take a look at this MERS virus. We've been tracking it in the news and in, with articles. Got a couple articles here. Of course, one is the beginning of the MERS virus brought to the United States from Saudi Arabia. And the other is a bit of good news among this MERS virus, that we'll see that a resident was able to maintain, though he tested positive for the MERS virus. But the first article I'd like to get to reads, patient with deadly MERS virus waited hours in a Florida ER. Now this is unbelievable, because having MERS, it could be spread to those who are in the waiting area, as this person was waiting to be treated, and should have been taken in right away when stated that he had flu-like symptoms. And we're going to take a look at that as well, the flu-like symptoms, because if you have flu-like symptoms at all, you want to address the situation right away. But the article reads here, the second U.S. patient to be diagnosed with the Middle East Respiratory Syndrome waited 4 hours before he was seen by doctors in Florida as 20 healthcare workers await test results for the deadly virus. After sitting in the crowded waiting room of the Dr. P. Phillips Hospital in Orlando, Florida, for 4 hours before being seen by a physician, it took another 8 hours for medical personnel to determine the patient had traveled from Saudi Arabia, one of the countries experiencing an outbreak of the disease, which is estimated to kill about 1/3 of infected people. The 44-year-old man was quarantined by hospital staff after they began to suspect the patient, who also works at a medical facility in Saudi Arabia, could be a carrier of MERS, a respiratory illness that begins with flu-like symptoms that may progress to pneumonia. Once again, this is big because it gives you an identifying factor. If you have flu-like symptoms, you want to get to the hospital right away, and as a result, make sure that they know you have flu-like symptoms and it could be subject to the MERS virus. So reading forward here, Dr. Antonio Crespo, the hospital's chief quality control officer, said that as of Tuesday, he had revamped procedures in the ER section of the hospital so that any patient who arrives with flu-like symptoms will be immediately asked whether they had visited Saudi Arabia or other countries experiencing MERS outbreaks. Now, it's important to point out here that you don't actually have to have went to Saudi Arabia to get the MERS outbreak. As we're reporting here, the man came from Saudi Arabia to the United States, and therefore it was spread at that point. So we'll see here that he took several flights and that many people could be subject to this outbreak. Now, reading further here in a quote here, it says that it is one of the learning lessons of this experience. Yes, we could have asked this sooner, meaning this person that's sitting in the waiting room with this MERS virus, we could have sooner. I think we have created more awareness, Crespo told Reuters. While the patient waited to be admitted, he was treated in a single room in the emergency department by healthcare workers who did not wear goggles and face masks that would have protected them from the virus, Crespo said. I believe as a result, if I'm not mistaken, that one of these workers did come down with the virus and was being treated. Now, it was also learned that the individual flew on 4 separate flights on a route that took him from Jeddah, Saudi Arabia, to Orlando, Florida. So once again, those who were on that flight could be coming down with the symptoms. Once again, if you have flu-like symptoms, you want to get to the hospital right away. You want to let them know that you have flu-like symptoms so they don't sit you in the waiting area. and that you will get medical attention immediately. Now, the U.S. Transportation Security Administration, in response to a request by the U.S. Centers of Disease Control and Prevention, is alerting travelers to the risk of MERS at 22 major U.S. airports, a U.S. health official told Reuters. So we want to get that information out. Once again, if you have flu-like symptoms, make sure you're taken care of immediately. Get to the hospital right away. So I did want to end on a positive note today as it pertains to this MERS outbreak and MERS virus. It reads here, Illinois resident tests positive for MERS but doesn't fall ill, and that is outstanding news. Lets us know that the human body can fight the MERS virus, and that anyone going through this situation has hope you can make it through this situation. So let's read here. A man in Illinois has tested positive for Middle East Respiratory Syndrome, being MERS, but has shown no signs of illness, U.S. health officials say. The case may shed light on milder forms of new deadly virus that kills 30% of those infected. The man is a business associate of an Indiana resident, and that Indiana resident is the one who contracted it from this previous man that we read about that came directly from Saudi Arabia, flying to Orlando. But the businessman is an associate or business associate of an Indiana resident who was confirmed as the first U.S. case of the deadly Middle East virus and likely contracted it from him. Though he did not seek or require medical help and is reported to be feeling well, a blood test on Friday showed he had developed antibodies to MERS, said officials at the U.S. Centers for Disease Control and Prevention. This is the third reported case of the mysterious disease on U.S. soil. However, officials at the CDC are reluctant to announce it as a confirmed case of MERS since the laboratory test is preliminary and detected only antibodies, not the live virus. The latest development does not change CDC's current recommendations to prevent the spread of MERS. Dr. David Swerdlow, who is leading the CDC's MERS-CoV response, said in a statement, it's possible that as the investigation continues, others may also test positive for MERS-CoV infection but not get sick. There is evidence that there is a broader spectrum of MERS than first expected, said Swerdlow. He also added that the CDC will discuss with the World Health Organization its system of classifying MERS cases to account for milder cases. And this is extremely important. As I said, this is a very good note to end on. As I said, the Illinois resident tested positive for MERS, but doesn't fall ill. This is excellent news. So once again, if you come down with flu-like symptoms, you want to get some help right away. You want to get to the hospital right away. Let them know that you do have flu-like symptoms and it could be subject to the MERS virus, to make sure that they do not have you wait in the waiting area and therefore possibly infect other people. I'm Keith Pitts with the iNation News Brief. I'll see you next time.